Hi, this is Dr. Chris Ward with the Dental Implant Center of Oklahoma. You know, a lot of times in our consultations, there's a lot of common questions that we get. So I'm going to try and address some of those just to make it easier where you can reduce your anxiety, learn more about it, and you can do that kind of wherever you want to with the internet the way that it is now. So one of the questions that I get a lot of times is, you know, if I'm going to invest in these dental implants and my teeth can't be saved, there's no way to really restore what I had or what I want, so we've got to go to dental implants. But if I choose that, how long will dental implants last? And you know, with that question, it's pretty loaded because there's so many factors. Just a quick overview to answer that, one of the things that will affect that is, you know, what's the overall patient health? Do they present as a pretty healthy person? Bone metabolism's pretty good in terms of I don't have osteoporosis, I'm not osteopenic. There aren't things that affect how well my bone grows and remodels itself, because that's done constantly over our lifetime. So if the patient's healthy, then the next thing that you consider is what are the mechanics that you're going to put on these implants. And depending on the type of restoration that you do, you're going to put different force factors on those. And we will address that specifically for the patients because they're all so different. But when you get a 250-pound linebacker in here and we've got to replace his teeth, that guy's going to put a lot more force on his teeth than someone that's maybe older and opposing a denture. There's just different forces that you can put on the implants. The more force and stress, you get to a point where you can overload those implants, which causes the bone to be remodeled, and then it almost creates a scar tissue instead of the bone growing directly to the implant. There's a gap there. You can have periimplantitis that happens from that, and basically the attachment breaks down over time until the implant's lost. So we can't overload it mechanically. So that's one of the things that goes into answering this question. In general, what's my maintenance like? Am I going to be diligent about doing the things that I need to do to clean my teeth? We have dentists that we partner with. Obviously, this is a specialty practice where we take the teeth out, we do the surgery, we fabricate and design all the final teeth, and at the end of that, you're restored, healthy, and very, very strong. But now, the rest of my life, I've got to maintain this situation, and we're going to teach you how to clean those. But we also have partnering dentists that we have that will help you with the maintenance component. I typically recommend the first year for a fixed type restoration that you're seeing every 90 days or 4 times a year that first year. That's something that if you have periodontal disease where you're dealing with bone issues already, that's a pretty common recare program where the average person goes twice a year, they get their teeth cleaned and they make sure everything's healthy. With a dental implant patient the first year, I recommend 4 times a year. With the partnering dentist that I use, they take those restorations off. We can unscrew them. They can clean and measure around the implants, make sure everything's healthy. They'll take x-rays, they'll clean the teeth. Then they'll connect them back and make sure everything looks good. Because with implants, we want to find any potential problems early. We don't want to get to where someone is catastrophic and now we've lost the whole case. We want to stay on top of anything. So if anything shows up, we want to deal with any problems early. And it's usually pretty minimal if we find anything like that. But it's critical in terms of maintenance if we want these implants to last. So dental implants are successful statistically if all those situations are taken care of pretty well. Most of the literature you'll see is 90 to 95% successful at 10 to 15 years. So 5 out of 100, maybe 10 out of 100 have some problems, maybe, have to have something done to maintain them. Ultimately, some of them fail. So it just depends. I have patients, I've done this 21 years where everything looks just about the way that we did when we placed it. So if they're diligent, healthy, do everything right, my expectation is, and my desire for them is that they maintain these like their natural teeth for their lifetime. But there are factors that do come into play. Systemic diseases, diabetes, a big one. Uncontrolled diabetes really affects bone metabolism, and it really affects how well your tissue heals. And so there are systemic things that do affect patients, and those are things that we'll address specifically with you when you come in for your consults. But I hope this was helpful, and if you have any questions, please give us a call anytime. Thanks.